The unprecedented pandemic of SARS coronavirus 2 has created worldwide shortages of personal protective equipment, in particular respiratory protection such as N95 respirators. SARS coronavirus 2 transmission is frequently occurring in hospital settings with numerous reported cases of nosocomial transmission, highlighting the vulnerability of healthcare workers. In general, N95 respirators are designed for single use prior to disposal. Amid a worldwide shortage of N95 respirators, a new study conducted by federal scientists found that the masks can be effectively decontaminated from SARS coronavirus 2 exposure and reused up to 3 times. While the research, which was published on April 15, has not been peer-reviewed, it offers multiple methods for extending the life of N95 respirators, which are basically designed for single use. Co-author Vincent Munster of the National Institute of Allergy and Infectious Diseases tells the New York Times that the research relied upon more than a decade of studies on decontamination, and it actually works as well for SARS coronavirus 2 as for influenza. Dr. Munster and his colleagues tested different decontamination methods on small sections of filter fabric from N95 respirators that had been exposed to the SARS coronavirus 2, including UV light, dry heat, vaporized hydrogen peroxide, and ethyl alcohol. Of those methods, they did not recommend ethyl alcohol because although it killed the virus, it degraded the mask material, and the vaporized hydrogen peroxide method was the most effective because it required only a 10-minute treatment, while UV and dry heat require at least 60-minute treatments. Volunteer employees wore clean respirators that had been decontaminated with all 4 methods in order to test whether the masks maintained a proper fit and seal over the face, which is crucial for reducing exposure to airborne pathogens. Ethanol damaged the mask after 2 decontamination sessions, and for that reason is not recommended by the authors. Dr. Munster also stated that even if the decontamination was successful but the mask fit was compromised, then obviously it is not really good for reuse. UV rays and dry heat treated masks held up for 2 cycles of decontamination but began to fail after 3, suggesting that they could potentially be reused twice, whereas vaporized hydrogen peroxide treated masks were unaffected, which means they may possibly be used 3 times. The US FDA had previously issued emergency use authorization for a number of mask decontamination methods, including one vaporized hydrogen peroxide system that could potentially decontaminate 4 million masks per day, and the US Centers for Disease Control and Prevention published guidelines on both extended use and limited reuse of N95 respirators. Another recent study from Canadian researchers, also not yet peer-reviewed, confirmed the value of decontamination. It included masks of different brands and found that the material of the mask was still effective after 10 rounds of vaporized hydrogen peroxide decontamination.